Good afternoon. Yesterday I started here with a pitch on the digital passport. It's amazing how this setup did when I met with these very clever people around me here. A few of them didn't make it today, but that idea was synthesized from just a wish to what we have now, which we came up to the level of a personal health passport. The learning point for me from all the colleagues I have here is that there was a need to be clear on what the ask is. And what we didn't want to do was to look for shiny new tools to find a problem for them. We had a problem first and try and see how we fix it. So digital nomads was our main focus. People that are up and about in the world, and your health record sometimes when you show up to the clinician, you're almost starting from day one like a new student in class. We also looked at patients that have both NHS and private sectors. So you're Bupa or wherever, and you want to make sure your health record follows you to all those places with you. And then students, and also patients that travel a lot. Those were the people we focused on. And I'll pass on to my esteemed colleague to just give together a picture.
Yes, so the main issue is that people who need to access healthcare outside of their usual home location face a number of difficulties. Generally, medical information can be quite fragmented, and for clinicians to access information from other health boards is also a challenge. We also learned that people want a way to structure their medical information that is just a filing cabinet or photo on their phone. So what might the use case of this be? You might be on holiday and you need to talk to a doctor about an issue you're having. How can you efficiently brief that doctor? And that's something we looked at.
So we developed an app where users can store their health records, such as discharge summaries or letters from their GP, and they can store this information locally on their device, whether it's a phone or they want to choose to upload it on a cloud service. And my team member will show you how a demo of this app.
Yes, we've thrown together just a quick live demo. This is obviously on the desktop. You can use it on the mobile as well, and we've got an example of that. So this would be the dashboard that you see. Let's say you've just been to hospital, you've seen a clinician, and you've been given a letter from your clinic visit, which is going to be just here. So you upload this letter, and then when you view it, you can see, so this chap on this visit has been diagnosed with type 2 diabetes, so we can add that in just here. That's been diagnosed today by the esteemed Dr. And then you can also see that he's been started on some metformin, so we can also add that in here. This, by the way, is something that we would love to have automated by AI. This is something that we didn't have time to implement in the course of this weekend. So you can add that as well. We've now added all of that, and when we go back to the dashboard, information has now been organised under these headings, and when you click on look at your diagnoses, look at this, and it takes you right back to that letter so you can see any information pertaining to that diagnosis. So we've just got a QR code. If anybody wants to have a little try for themselves, and we'll take any questions.
If I may just add, you'll find also that there's a bit more automation in the app you've got on your phone, as you can access your cameras, take a picture, photograph to scan your documents, etc., making it a much easier process.
Good. Lots of live working demos today. Questions?
Love it. Talk to me about security.
Oh, so I just get one question here for security.
Right, on security, let's take it away. It's a personal record for yourself. So one of the constraints we made was that you're not going to be a big target for any bad actors because it's only you and your record. You're not integrating to millions of other patients on it. So it's a record you only own. So we saw that as a good way to separate the need for the bad actors because they tend to like the big numbers. So if it's my only record...
It's only stored locally?
Yeah.
Not
It's
only
stored locally.
The idea, and it's only be stored locally. You're going to take the information onto your phone, and then you're going to use your phone as a means to inform your clinicians.
Paul, are you okay? Yeah.
No, just ask, travelling overseas and you've got non-English speaking healthcare professionals, a valuable app, but is it linked to translation facilities?
that's something we'd love to include. And also, if you've been abroad and got a letter from abroad that's not in English, that could be translated back in and added to your record as well.
Yeah, good. Any other questions? Huh? It was brilliant. Come up there, comment. Any other? No?
Yeah, I have a question. So I have just tested your thing. So it could look like that anyone can actually make it. What makes yours distinguish from what would you do to distinguish yours and make you stand out from your rivals and others?
It's the only one that exists.
How does this? It looks like that I could make it myself and then sell it.
Not everybody's as clever as you, and they're doing this to try and support people to be able to do it that can't do it themselves.
It's simply a prototype. Obviously, it will probably be expanded, as I say, we're planning on adding in.
Thank you.
Thank you, and it's what we could do in 48 hours. And maybe